For weeks now, Global BC has been reporting on the shortages in our healthcare system and the impact it's having on the day-to-day lives of residents. And rural communities have been hit particularly hard by a lack of family doctors and rolling ER closures. Here to talk more about this is Paul Adams with the BC Rural Health Network and Village of New Denver Mayor Leonard Casely. Thank you both for being here.
Thank you for having us.
Now, Mayor Casely, let's begin with you. How big is your community, and can you walk us through the impacts it's been facing lately with these closures?
Our community is about 590 residents just within the community, but we are on the shores of Slocan Lake with a community 5 kilometers away and another community 25 kilometers away served by the center with a rural area of about 2,000 people as well.
So when these closures or reductions in service and lack of staff, what kind of impact is it having on New Denver?
Well, it has a fairly serious impact in the fact that it plays a role of our regionally ER is in Trail, which is approximately 2 hours away from us. We have another community north of us in the cusp with a ER, but if it's serious, you're going to Trail no matter what. So adding more time going north instead of going south to the regional really puts a strain on people deciding on what they're doing for their care.
Yeah, no kidding. A lot of stress, absolutely, at a stressful time, right? So, Paul, for you, do you feel that the public is fed up? Do residents feel like healthcare investments in rural BC are just being ignored?
Yeah, I think the rural resident is feeling left out of the conversation, and sometimes we're listened to, but we feel that we're not being heard. And getting involvement back into the management of healthcare within our individual communities, I think, is critical. We're all unique towns and have unique needs, but there seems to be the underlying problem that we're seeing throughout British Columbia, and it's from Vancouver Island all the way up to the far north, Jen. It's not just in isolated areas. This morning there was another announcement on Creston, but we've seen Clearwater, New Denver, Nakusp, Port McNeill, Ashcroft, Fraser Lake, Slocan, Hornby Island, Denman Island, Galliano Island, Salt Spring, East Kootenay Shore, 100 Mile House, Grand Forks, Oliver, Fort Nelson, and Lillooet. Just in the last month or so, see reductions or closures and people having to find care elsewhere. So we're looking to try and get people back involved in the management of their health within their communities through communication and solutions-based approaches with government. And the BC Rural Health Network is an umbrella organization bringing all of these communities and groups together.
Now, Paul, for you and your organization, what is the main stumbling block to get people to come to these smaller communities?
Well, there's so many factors. I mean, there is a shortage of staff throughout BC. So attracting physicians to a small community can be quite challenging. And so we need better incentive programs, but we also need more rural students being trained into the medical field. And it's not just physicians and nurses, it's throughout the entire healthcare industry, including from the volunteers all the way up.
Sure.
And, a lot of our members are volunteers working in communities, and they're the glue that keeps the system moving forward, and there needs to be investment made in the volunteers in the communities as well. So we feel that, having nursing seats and having physician seats is definitely needed. More money is needed to attract people, but we also need to be attracting rural students into those seats so that they will return to small town communities, and there is a trickle down effect, so it impacts our urban neighbors when we see short staff. Yeah.
All right, and Mayor Casely, finally, I wanted to ask you, last weekend there was just one available ambulance attendant for the surrounding communities in your area. Do you feel that rural communities are being abandoned? What would you like to see be done immediately?
Well, I think we need to sit down and have an honest conversation with the health authorities and put all the stuff behind us and look at the problems, look at what's going well and what isn't going well. We did mention this to BC Ambulance at the beginning when they did the model change, that from talking to our attendants and stuff, we lost attendance. We actually have less service now than we did under the previous previous agreement they had with the paramedics. And you can't blame the paramedics. These folks are doing their best and putting in huge amounts of time and care in rural BC over and above what they're being paid for. But this is where I think it gets back to where we need to get back to a bit more community-based management to oversee these troubles that we have with BC Ambulance and with the healthcare and all the physicians and in rural BC. Because rural BC is different, and you have to look outside the box. We've been very unique in the way we did our doctors. They work 10 days, 24/7, and do a rotation of that between 3 of them. And
yeah, it's been very difficult.
Works.
It's been very difficult all around. Well, continued health, hopefully, for everyone in the area, and that these problems can be figured out. Thank you both for your time and for the care you're taking for your communities. That's Paul Adams with the BC Rural Health Network and Village of New Denver, Mayor Leonard Casely. Thank you, gentlemen.
Thank you, Jen.
Thank you.